Senator Braun.
Thank you, Madam Chair. So I'm going to have two questions, and I'd like Dr. Tabak and Dr. Fauci to answer each of the two questions. I'm going to start with this one. So in navigating through the entirety of what we did to fight COVID, clearly the most expensive feature of that navigation would have been lockdowns. We did that out of uncertainty. We had no idea, how that was going to work. Even in the business I ran, you had early dust-ups where you'd get a case, it'd clear out a warehouse. We quickly understood you don't throw caution to the wind, and you take the basic information that we all had to deal with, and you took it seriously. You put protocols in. Let's look at lockdowns. Cost us trillions of dollars. And, we're paying for that now with super high inflation. And I think I'm interested in when Johns Hopkins comes out with a study that said basically that didn't have any impact on mortality. And I don't know that study addressed what mortality might have been impacted in terms of deferring other, health care. Can we take lockdowns off the table in terms of what we do in the future? Dr. Tabak and then Dr. Fauci.
I can't say because I don't know what that future holds for us. If you have a pathogen that is very virulent, very infectious.
Let's assume it's in the same modality as what we've been navigating through over the last 3 years.
I think the initial presentation of the virus was one that was devastating. It killed a lot of people.
What about the study that Johns Hopkins did? Because we're always saying pay attention to the science.
I'm not familiar with that study, sir.
Dr. Fauci.
That's a very good question. If you're going to lock down, you've got to use it temporarily for a reason to prepare you to be able to unlock down and get the public prepared for that. Right now, looking forward, I don't see the need of lockdown in the future unless something really very, very unusual happens. And the reason is that what we really need to do is we need to get our population vaccinated and we need to get them boosted. That would completely obviate the need to lock anything down. So right now, if you ask me the question, looking forward, do I see, even if we do get a new variant, I think the vaccinations that we have enough cross-reactivity and our ability with proper resources to make variant-specific boosts. I don't see lockdown in the future. Lockdown is a temporary thing to get you to be able to move quickly to save lives.
That is good to hear because in that kind of moment of uncertainty, I don't think we could afford to do it again, and I hope the Biden administration is listening to that.